Okay, good afternoon. Like I said, I'm Stacy Hunt. I'm a licensed clinical psychologist and the clinical director at South Central Human Service Center in Jamestown. We are going to be talking today about the WHODAS. So first of all, what is the WHODAS? I think we're all familiar now with the WHO because we've been hearing about it a lot in terms of COVID, but it's the World Health Organization, and this is their disability assessments schedule. So that's where we get the WHODAS. So we use the current version and the most up-to-date version of the WHODAS, which is the WHODAS 2.0. The WHODAS 2.0 is an assessment tool used to measure health and disability across cultures. How did the WHODAS come to be? This WHODAS, the WHODAS 2.0, was a joint project between the WHO, the National Institute of Health, the National Institute of Mental Health, the National Institute on Drug Abuse, and the National Institute on Alcohol Abuse and Alcoholism. So I think sometimes when we work in integrated care, we worry about that our assessments that we use maybe aren't normed on the population that we're working with, both our folks who struggle with mental health issues and also people who have substance use disorders. But the WHODAS is normed and developed looking at all of those across someone's functioning levels, so all areas of functioning. Real quickly, how was the WHODAS developed? International experts looked at about 300 instruments, and they used the ICF, the International Classification of Functioning, as a framework. There were 96 items grouped into 6 domains, and we'll talk about those 6 domains. And then they used field studies to reduce the number of items and increase their reliability. So it's very reliable. Did lots of validity testing. The WHODAS looks at 50% of the individuals studied for the WHODAS 2.0 had mental health or substance use problems. So this was normed on the population of people that we serve. So it definitely has its use, and that's why we use it in our mental health and addiction treatment. So what does a WHODAS look at? So it looks at both positive and negative aspects of functioning. So it's really assessing an individual's limitations and restrictions regardless of their specific medical diagnosis. So in addition to things like diseases, disorders, and injuries, it takes also into account their personal factors and environmental factors. So why do we do the WHODAS? Those of us working in human service centers, we don't just rely on a diagnosis to determine what we do and how we treat somebody. We also have to look at somebody's functioning level. And across diagnoses and across a person's life in general, there can be lots of different functioning impairments or areas where people are functioning well, regardless of their diagnosis. So the WHODAS looks at those biological, psychological, social, environmental, and other aspects of someone's functional capabilities. So let's talk about diagnosis doesn't define how we work with people, their functional status, or what they need, what we're going to do to serve somebody. So bipolar disorder is a good example. On the left, you'll see somebody, this kind of defines somebody who really has a lot of functional deficits related to, their disorder. They're taking their meds. They have trouble concentrating or following conversations. They aren't eating, and they're impulsive, and they have some relationship difficulties. But you can see somebody who maybe we've worked with and we've helped them with all these things, right? We've built those skills with them. And now, a couple years later, they're reassessed. Well, they still have bipolar disorder, right? Because it's a serious and persistent mental illness. But now they're not missing their meds. They take their medication, which helps, as we know with mood disorders, make people very stable across their days and weeks and years. They now maybe are a peer support, and they go out and they talk about bipolar disorder and do a lot of public education. Maybe they're eating better, so they're not having those manic episodes where they are eating, so they're eating more regularly. Maybe they have some weight gain from some of their medications, but they're not. It's not a big functional deficit, and they've developed some strong friend and family relationships. So same diagnosis, very different functioning status and functioning assessment. So what do we do when we look at the WHODAS? What does it facilitate? Well, the WHODAS really is a reliable cross-cultural description of function, so normed on many different cultures. There's a scientific basis for understanding and monitoring functionality, so we're not just guessing. There's reasoning behind why the WHO uses the question it does, and it uses common language. And we'll look at the WHODAS because I think sometimes some of the questions or a couple of the questions can be misunderstood or might need some clarification, but overall, people really understand the WHODAS well. So who do we give the WHODAS to, or how do we use it, right? So we do it because the DSM requires the WHODAS for a functional assessment, right? So we went from the GAF, that was an old DSM, now the DSM-5 wants us to use the WHODAS. Additionally, the Department of Human Services has adopted the WHODAS as our functional assessment. And specifically, also to this training that we talked about a little bit ago, Medicaid, North Dakota Medicaid services have their requirements, you also use a WHODAS score as well. The WHODAS for kids and adolescents is not available now. The WHO is still testing it, and we've just actually checked again with the WHO not too long ago to see if it was done, and it's not. So as soon as that one is available, then I think we'll begin using that too. But we'll talk about how we assess youth in a little bit here. There's a couple different versions of the WHODAS. Typically, and what's in Avatar is the 36 item. So there's the 36 item, which is the standard, especially if you give the self-administered, it's the standard assessment I think most people use. Although you can use a shorter 12 item, or you can use the 12. And if this is the one where if you do it on the computer, if you use a computer adaptive scoring, it does add 24 items if it needs to. So then within the 36, we'll talk about the 36 item version. There's 3 different forms. There's the interviewer, the proxy, and the self-administered form. So sometimes I think we get in the habit of, at the centers specifically, of wanting to use the proxy more than we should. We want to really keep our number of proxy version WHODASes, especially with our adult population, to about 10% or so. And I think sometimes we think, well, our clients aren't good reporters of their own functioning level. However, we have to remember the WHODAS was normed on people with mental health and substance use disorders. And so we want to always try the self-administered first, and then we can talk about times where maybe we would do a proxy or we would do an interview after that. So how do we do the WHODAS administration? Prior to our electronic health record, we did paper and pencil, and then we scored it, hand scored it. You can still do it that way, and in the WHO manual, you can print off copies and use it. It takes about 5 minutes to do the self-administered, so it doesn't take very long. We do want the WHODAS to be repeated every 6 months at least. So sometimes we'll have people do it over the phone in the interview version. We also can do the interview version in person. And then the proxy version is done by a third party. So that also can be done over the phone or in person. Just real quick, the WHODAS use. Okay, so why do we use it? It's short. It's available in more than 30 languages. It's got good baseline and data and ongoing assessment. And it's also easy to find. It's in the public domain. So lots of organizations use it. It's not something that you have to purchase. You can Google it and find the manual for it. Here's all the translations that the WHODAS is in. So when you do go look for the manual on the WHO website, make sure that you find the English version. Okay, so what are the 6 areas that the WHO looks at? So there's 6 different domains. So we want to really understand somebody's cognition, so how they understand and communicate, their mobility, moving and getting around, their self-care, which is really important for us in the treatment that we do with folks, getting along and interacting with other people, their life activities, and then their participation in community activities. So the WHODAS, one nice thing that why we use the WHODAS additionally is we want to do it in a standardized way, right? So I think we always work on this in terms of, at least at my center, in terms of, are we making sure that when we do the WHODAS with somebody, especially when they come in at triage, that we're doing it the same way every time, right? So we want to give people some sense of privacy. You don't kind of want to look over their shoulder, or if they're doing it on like the kiosk or the tablet, that they have their own space to do that. We do want to use the flashcards, and we'll talk about those in a minute. But we do want to use the flashcards for with the WHODAS, especially the self-administered version, and then use the frame of reference for answering the questions. So those are true with all 3 self-interview or proxy version of the WHODAS. So what are the flashcards, okay? Hopefully you all have these printed out and give them to staff, and laminate them so you can kind of use them over and over again. So the flashcard number 1 talks about the definitions of health conditions, and then what having difficulty means and the time frame. And then flashcard 2 is the Likert scale, just to orient people to that. So this is the first flashcard. So you want to give this to the person, and you want to talk about when it mentions health conditions, because sometimes when people say, well, what do you mean health conditions? Are you just talking about my mental health? Are you talking about my physical health? Really we're looking at across the spectrum. So any physical diseases, illnesses, or other physical health problems, any injuries that you have had recently, mental health, behavioral health, and then drug and alcohol health conditions as well. So, and then if we don't say this, people sometimes ask, well, what do you mean having difficulty? What's having difficulty means? And so you can say something like, well, having difficulty with an activity just means that it takes you longer to do it, or you have to put forth more effort because of one of your health conditions. So it's always kind of related to those health conditions. So do your health conditions make it more difficult for you? Do they cause you discomfort so you can't do something the way that you want to do it? Are you slower, or does it in some way change the way that you do the activity? And then we want to think about the past 30 days when we're doing this. And the reason for that is because 30 days is a long enough time where we can get kind of an average of how somebody is doing, but not too long of a time where people don't remember, or not too long of a time where we get like a lifetime history. It's very current. We always want to assess people's current functioning. But if we would say, well, how are you functioning today? I mean, that may be different than how they functioned 2 days ago or how they functioned a week ago. This is flashcard number 2, and it's a Likert scale. So we always call a scale like this with weighted and ranked numbers. A Likert scale is what it's called. 0 or 1 is none, so no difficulty. Mild, moderate, severe, and then extreme or cannot do. So it goes from none to extreme impairment. And then here's our frame of reference. So just for standardization of the assessment and to ensure individuals understand the context to be answering each question, the WHO advises that all respondents have the 6th frame of reference reviewed with them prior to completing the WHODAS. So here at the Human Service Centers, we have a standardized computer recording of Dr. Croach explaining this. And so it's like a 2-minute and 37-second video where she does a really nice job of explaining these frame of references and kind of and doing this explanation. And so it's really helpful to use that if you're not using it, because that's kind of our standardized way to do that. If you don't use that, then when you look at the manual, it gives you a format or what to say to explain these frame of references. So frame 1, again, the degree of difficulty, that the difficulties are due to your health condition. Think about the last 30 days, average those good and bad days. So sometimes if people say, well, this week I'm not doing well and that's why I'm here, but last week was pretty good. You say, well, if you think over the last month, just average those good and bad days together to get a good average of that as you usually do the activity. And then what are the NA items, and we'll talk about that. So again, we talked about having difficulty with an activity means increased pain, effort, slowness, or changes. Okay, due to our health conditions. So an example of this or where you might see people struggle with responding, we want them to talk about if they say, I can't walk, one of the questions is, can you walk about a kilometer? Okay, so that's like 12 or 13 blocks. So if they say, well, I used to, but 2 weeks ago I fell and hurt my knee, and now I can't walk that far. I can barely make it. Barely made it on the bus to come here today. Then that they would probably say like moderate or severe, extreme in that area. It doesn't have to be just related to their difficulty. Doesn't have to be related, to all of these areas, but it has to be related to, think about any of them. Again, their recallability is most accurate for a period of a month or so. We want to average those good and bad days. Okay. So this is kind of one where we might need a little clarification. So as the respondent usually does the activity, okay, so take into consideration how they usually do it. If the person doesn't have any difficulty with doing the activity due to help or assisted devices, like if they're in a wheelchair and they can travel a kilometer in their chair, then we would rate that as none because they don't have a functional impairment in that area. Or if the person can read because they have bifocals, then we would say no impairment because they can with assisted devices like glasses. And if an interviewer wishes to evaluate the added value of having help or technical assistance, they can ask the question twice and record both answers. So you could say none with help, like glasses or wheelchair, or extreme or cannot do without help. Then the last frame is there's some areas, and if you do the 36 administered WHODAS and the person isn't working, there's 4 questions then that they just NA because they aren't working. Also, typically, I'm going to go back to this whole walking because that's a good example of it. Can you walk a kilometer? If somebody says to you, well, I mean, I want to. That's really one of my goals is like I want to start running 5Ks again. And so I'm here because I gotta, start feeling better so I can go running again. But they don't at this time, okay? So then we would say, that they have difficulty in that area because they're not doing it and they're not able to do it right now. So we look at what they're actually doing, not what they would like to do or can do or wish they could do. Okay, so which one would you do? Let's talk a little bit about our different assessments. Okay, so the self-administered one is nice because I think it's the shortest. I mean, the person is sitting in front of either a paper copy and they're answering the questions, or they're on a tablet and answering the questions, or maybe we'll use the kiosk and answer the questions. So it's fairly short. It usually takes about 5 to 10 minutes to complete. And I think especially as people are in services and they've done a couple of WHODASes, that first one might take a little bit longer, but if this is a repeat one, it tends to be shorter. The instructions about answering the questions are written at the top of the form, and we'll take a look at the form in a little bit here so we can see that. There's a written prompt before questions in category D to only complete that section if you're working or going to school. Okay. The benefits of interviewer administered. This needs to be done again in a standardized way. So if you're somebody that's going to complete an interview administered WHODAS, try to do it the same way every time so we can really keep to that standardization of how we do it. It takes so the instructions on the WHODAS interview version are written in bold and italics, so they're pretty easy to follow. And if you look at the WHO manual, it's actually got black and then other instructions in a blue text. And so if you can, it's nice to print those off in color. So it's a prompt for you and I say this and then this is just additional instructions for you. It takes about 15 to 20 minutes to do that 36 item form. It depends on how functionally impaired the person is. I know sometimes at our triage we try to do a WHODAS, and if it's really not going well and taking a long time because the person's disorganized or really emotionally activated, that's kind of our prompt to maybe look at a crisis screening instead, because if the person really can't focus long enough to do that, even answer those 36 questions, then maybe now is not the time to really do that assessment with them. For this one, you get additional demographic and background information. And you also use it tells you when to give the flashcards. And again, it records the number of days that you were unable to carry out activities or had to cut back. Okay, the proxy. So the proxy version should be used when the person cannot complete questions on their own. It can be done by a friend, a relative, or a caregiver. So you identify on the form, the person identifies their relationship, and then they answer the questions to their best knowledge. The form uses the term relative, but it's really meant to be inclusive of all relationships, because it might be someone they work, like a case manager or a therapist, if they've worked with the person long enough and they really know them. It might be a guardian. When we talk about doing this with youth, it might be their guardian from the county. It might be a foster parent. It might be, someone outside of that relative type relationship. So sometimes what happens when we do the WHODAS is we give the WHODAS to somebody, and then we get their score and we say, I don't think this is right. They aren't functioning as well as this. Their score should be a lot higher. And I think with what I found and what we found is folks with like real delusional thinking or schizophrenia, they probably aren't insightful into their functioning in the world to really accurately provide those answers to the WHODAS if they're not functioning well. If they're stable on meds and doing well, then they could probably give an accurate assessment. But what I see happen is that we tend to, as professionals, especially if it's clients we've worked with for a long time, we don't recognize their gains sometimes, and we think that they're functioning there's more functioning impairments than they're telling us there are. So it kind of goes with that, like recognizing that people recover. And how do we recognize that? And sometimes we notice that through a WHODAS score. So it's important when we're doing the WHODAS to be aware of our own individual opinion and experiences with the person and our own judgments. It's important to look at like what functioning looks like, where we're not overestimating, because if we would do the WHODAS on ourselves, I always used to say this about the GAF. I mean, I've never met anyone who got 100 on the GAF. I mean, on a good day, my score would be like a 70, 75, and the WHODAS is kind of the same. So, we have to look at that range of functioning and make sure that we're not either over or underestimating somebody's, or just that range of what good functioning or healthy functioning looks like. Okay, any questions about that so far? Okay, so you're given the WHODAS. Somebody has a question. What do you do? Okay, so we're just going to go through kind of a couple of examples. First of all, don't panic. The WHO doesn't want you to figure this out for itself. In the manual, there's very detailed prompts of what to say if somebody asks a question, and this is part of it. So if you look in the manual, this is question D1.1 on concentrating on doing something for 10 minutes. Okay, so this is their explanation. Defined here, a short period of time. Most of the time people understand this item. However, if you need to clarify, encourage the person to think about their concentration in usual circumstances, not like when they're in crisis or they're preoccupied with something, or they're in a really distracting environment, like maybe the lobby of a human service center, where there can be a lot of people around and maybe they're having a hard time concentrating on the WHODAS, but normally they're concentrating fine if they're like at home. So it gives you all of these examples in the manual of how to respond, which is nice. So you don't feel like you have to make things up, and you don't feel like you have to really come up with something on the spot. Okay, so this is a good context example. Do you have in the past 30 days, have you had trouble staying by yourself for a few days? Okay, so the intent of this question is to just determine if people have difficulty staying alone for an extended period of time and remaining safe. So, some of our clients do, they either don't live alone, or they, if they were alone, if whoever they live with left, could they stay by themselves and be safe? Could they cook and clean and take their meds maybe, and remember their hygiene, and or would they have to go stay with somebody else? Okay, so then you say this one could be NA. So if they did not experience this situation in the past 30 days, so they were in a family and they were living with somebody the whole time, then that would be an NA because we wouldn't know in the last 30 days. A lot of times people have questions about related to sexual activities. And sometimes when I've done the people will say like, well, is it talking about have I had sexual intercourse in the last 30 days, or am I comfortable with the amount of sexual activity I've had? And some people ask just like, what do you mean sexual activities? So, you can explain that this includes lots of other, not just intercourse, but hugging and kissing and other intimate acts. Okay. Before we talk about scoring, does anybody have any questions? Oh, I skipped a slide. Okay, so how do we do the WHODAS with youth? Because as you recall from a couple of minutes ago, the WHO has not released the youth and adolescent WHODAS yet. However, we still need to know the functional assessment of youth, right? We need to know it for treatment planning. We need to know it to determine eligibility of services. So how do we do that? Here in the Department of Human Services, we have decided to use the WHO 2.0 with youth, and we just have to be a little creative with how we do it, okay? So our estimation, the WHODAS 2.0 has about an approximate reading level of 8th to 12th grade. So it's actually a really high reading level compared to like some of our psychological assessments that we use. They have a reading level of about a 4th to 6th grade level. So the WHO is actually, it takes a lot more of that reading skill to be able to complete on your own. So in that case, the recommendations really are that for anyone except if you have like a high functioning older adolescent, you could let them do the WHODAS on their own. But really we want to use either the interview version or the proxy version with somebody else. So what you could do is you could do the proxy version and have a parent or guardian complete that on their own. Or you could do the interview version and have the parent, guardian, and client together and kind of fill it out, depending on how old the client is. I mean, I would maybe do that with a 12 or 13-year-old, but if it's a 6-year-old, I just have the parent do the proxy version. So it really is leaving it up to our discretion about what makes the most sense in each individual case, but that's a pretty high reading level that I would really recommend you not have anyone under the age of 16 complete that self-administered. Any thoughts or comments or questions about that? Okay, so scoring. So we're going to talk a little bit about simple scoring. Back before we had Avatar and or the WHO and WHODAS and Avatar, we did simple scoring. And this is how, if you don't have access to the complex scoring, this is how we would do that WHODAS, the simple scoring. So you just sum up the scores. You sum up your number of 1s to 5s. They're not weighted, so each score gets its own. It's the same weight. And the scoring is specific to the person. However, there is something to be said about the complex scoring. So the complex scoring is nice, and we're not really going to go into this much, but just to talk about it a little bit, it weights the items differently, and then so it recognizes the code for each item. And then they sum the scores, they sum all 6 domains and convert the summary score and ranging in a metric from 0 to 100. So that's why our complex scoring WHODAS gives us an average score of a 50, where the other one, it's a score of 1 to 5. And this allows for comparative analysis across populations, not just the simple scoring what can tell you how one person is doing over time if you repeat it, but it doesn't measure that against other populations. What do you do if people are missing data? So again, if they aren't working and aren't in school, then they skip domain 5. And so you end up with 32 responses on the self-administered. You just go ahead and use that score as it is, and that's comparable to answering all 36 questions if those are NA'd. Other situations where 1 or 2 items are missing, when somebody hands you the WHODAS, look through it, and if they've skipped one, it's usually because they've skipped it or they don't know the answer, they don't know how to. So just ask them and just ask if they can they finish that domain, because you really kind of need those scores to accurately score those domains. Okay, so here's the difference. I think if we look at like, if we're having a WHODAS score that's done by an outside of DHS provider who maybe isn't using the complex score, then we need to know, like, what is the comparison there. So this is just a little graph of the comparison. If we have a score of a 25 to 49 and a complex score, that's comparable to a 3. 5 is really a 96 to 100. That's pretty highly impaired. And then our 1 is a 0 and 2 is a 5 to 24. So why do we do, just as we're wrapping up, why do we do the WHODAS? Why does it matter? It helps us in our healthcare decisions, helps us in policy decisions. It helps identify needs, match treatments and interventions, measure our outcomes and our effectiveness. One way that we measure how people are doing well and how that they're getting better and our treatment is working is that their WHODAS score is going down, and that's great. It helps us set priorities and also allocate our resources within our organizations. Here's the link to the WHODAS, and I'm actually going to show you guys what it looks like here. So I'm going to stop sharing my screen for a minute. Okay. So this is the WHODAS Manual, and I skipped to page 101. So in the PDF, there's a lot of good explanations. There's even a quiz there where you can quiz yourself and see if you know all the answers. But then it gets to the different forms. So this is the 36 question interview form. This is the first page. So it tells you the instructions are written in bold, and then the text for the respondent to hear. So what you want to say for them is in blue. So this is why I say, if you're going to use this, print it out in color if you can. Otherwise, you can't really see that. You want to make sure you're reading the right thing. So this is all you have to read this part. If we do this self-administered and you have it and you use the video, then the video goes over this stuff too. So it tells you how old are you, all these questions. Here's the flashcards, point to the flashcard, hand the flashcard to them. I mean, it really takes you through it, and so that we're all doing it the same and all doing it in a standardized way. So now we're going to ask some questions about understanding and communicating. So you just ask these questions and mark down their score. Okay. There's the flashcards. This is what the 36 item self-administered looks like. You explain this, read this paragraph, and then you hand it to them to do. Tells you to go to the next page. And done. And this is the proxy administered. And that's it. questions that people have about the WHODAS? Okay. Hold on. Thank you for attending this training. If you have any further questions, please let me know.